CURES is sponsored by Wheeler Health's Better Choice program. More at wheelerhealth.org.
Helping you lead a healthier life. This is CURES.
Hi, everyone. Welcome to the CURES Show, where we explore the cutting edge of wellness from credible sources. I'm Kara Sundlin. October is coming up, and that is Breast Health Month. But it's never too early to change your breast fate. Lower your risk factors. And there are really ways you can do that. And we're just happy to be joined by our good friend, Dr. Artemis Morris, a board-certified naturopathic physician, a licensed acupuncturist, and the founder and medical director of Artemis Wellness Center in Milford. Thank you so much for being here.
It's always a pleasure, Kara. Thank you so much for inviting me.
Yeah, I want to congratulate you. You just got a grant, and you're really launching a program to reduce this horrible statistics that 1 out of every 8 women will end up with breast cancer.
Yes, and it's something that can have modifiable risk factors. So this is what we want to do in the program, is to help people become aware of the 50 to 70% of the risk factors that can be modifiable.
Okay, and you have a cute name for the program.
Yes, we do. It's called Your Breast Self.
Your Breast Self. Okay, and this is for people who want to be on the prevention track, or perhaps people who have already been diagnosed and even treated for breast cancer?
Yes, it can be both. So it's really about shifting from breast disease to breast health. So, health being all of the modifiable things we can do with diet and lifestyle and nutrients and stress. And so we're going to get into it, and it's for anyone who wants to prevent it, especially in Connecticut, because it has one of the highest rates of breast cancer in the country.
Yeah.
Prevent a recurrence or just lead a healthier life with a better breast health.
Yeah, so it's a 21-day program. We'll talk a little bit more about how you can sign up. You can go online and do all that. But first, just to give you a 21-day journey from fear to feminine self-empowerment, your breast self. So you may think that you know a lot about breast cancer, but I guarantee you're going to learn something here, because you kind of dive deep, especially into the prevention. So let's just talk about pain. If, a lot of times women, we just ignore things or we push through when it's not that serious, but you want everyone to know that breast pain is not normal.
Yes, and I also, besides being a board-certified naturopathic physician, I'm also a licensed acupuncturist. And so what I'll do is combine Eastern and Western medicine in the program. And any kind of pain is your body saying something. So in Chinese medicine, it's called qi stagnation, but breast pain can be a call that your body, something's wrong, hormone imbalance. But just rest assured, everyone, it is not generally a sign of breast cancer. It is definitely a sign that something is off, though.
So a lot of times we won't know that you have breast cancer until it's picked up. But so feeling a little pain is not, you shouldn't be like, oh my gosh, I have cancer. It usually is something else.
Right. So, my goal is not to create any fear or anxiety, is to reduce it by really sharing these incredible modifiable risk factors that can reduce the risk by 50 to 70%.
Yeah, and so let's just talk about that. We'll talk about some of the things that can cause pain, but like when you say 50 to 75% of your risk factors could be reduced by lifestyle,
yes.
What are some modifications?
Yes. Well, first of all, starting with understanding ourselves. So any of those changes that are happening, you definitely want to tell your integrative practitioner about it, because those are clues as to what's wrong. So as you know, in naturopathic medicine, we like to treat the cause rather than just address the symptoms. And so the lifestyle, diet, supplements, there are many things that we can do. Even early detection methods like thermography can complement, some of the screening tests that you're doing.
Okay, so we'll get into some of the supplements, but if you are causing pain, if you have pain, pretty common that it could be, your birth control pill, or maybe you're doing some HRT. So sometimes you might have some moderate pain from medications.
Absolutely. So anytime you have breast pain or tenderness, hormones are one thing that can be causing it. And so if you're on the birth control pill or you're on hormones, that is definitely one thing that can affect it. If you're pregnant, you can have breast tenderness, but it also is a sign of hormone imbalance. And we used to think it was mostly estrogen dominance, but there is some very interesting new research coming out about hormones, and it's really showing that maybe progesterone is more of an issue. So it's all about the balance, and we actually have an amazing functional medicine tests on our website now we're offering that we're going to use in the program called Hormone Zoomers. If you go onto the website under specialty labs, look for Hormone Zoomer, and we can test not only your hormones, but how you're metabolizing it, look at endocrine disruptors, even look at some bone health markers, and that will really be helpful.
Wow, okay. So important to get some of these tests. And again, you've got a quiz, a free quiz that people can take. You can sign up for this program, and then it tells you exactly what kind of tests. But let's just talk about one kind of test that you would really, even if you're not going to go to a naturopathic physician, you recommend we all get our vitamin D levels checked, because vitamin D is one simple thing you really want to see most people supplementing.
Yeah, so there are many nutrients that are tied into risk factors for breast disease, including breast cancer. One of the ones that's been studied the most and has some clear mechanisms is actually vitamin D, the sunshine vitamin. And we've talked about that in reference to immune health. It helps prevent respiratory infections in kids. But there are studies showing that it can reduce the risk of breast cancer anywhere between 45 to 80%, according to some studies. And this is not just like take a little bit of vitamin D. This is get your 25-hydroxy vitamin D levels tested. Let's see where you are. We also need to understand what might be affecting your vitamin D status in terms of your particular genetics. And let's figure out the dose you need to get to optimal levels, which are more like 40 to 60 nanograms per mil.
Okay. So you want to make sure the vitamin D is good, and this is for any age. It also helps us in this flu and cold season. Also, I didn't realize this, but you say diet, like certain things you're eating. If you're drinking too much caffeine, it could create breast pain?
Yes, I mean, I have a personal example. So we were at the Greek festival, we always volunteer every year, and I had a frappe. I was making some frappes, and I have to say that night was a little rough.
Okay.
So caffeine, what it could do, because even 3/4 of women can have something called fibrocystic breasts. And we don't call it fibrocystic breast disease anymore because it's not a disease. It's just the tissue of our breasts tend to be a little more fibrous, and that can make them more sensitive to diet, to caffeine, to not having enough nutrients so that our tissue, breast tissue included, can get what it needs to be happy, healthy, and not be painful.
Okay.
Yeah.
Okay. So that seems easy. Just reduce your caffeine if you notice it's giving you pain. Anything else that we really should try to eliminate as much as possible from our diet that could impact our risks?
Well, a lot of the studies, which I'm so happy to hear about, because this is one of my specialties, are really saying that a Mediterranean diet is the best diet for not only preventing heart disease, which we've known about since the 7-country study in 1960, but now it's also for breast health is very important, for reducing risk of cancer. And so in terms of breast disease, the omega-3s found in a low-carb Mediterranean diet are really anti-inflammatory. So another thing is inflammation, as we know, is the mediator of all disease.
Yeah.
Cancer, heart disease, and that's the book that the 3rd revision came out, The Anti-Inflammatory Diet for Dummies, that I wrote with Molly.
Inflammation is basically, just so people can catch up here, is sort of the root of all disease. It starts with some level of inflammation in our body. So you want to make us not inflamed. And omega-3s would be like fish oil. We could eat a lot of good, healthy, fatty fishes. If we're not doing that, you would recommend we probably should be supplementing with a high-quality omega-3 vitamin.
Yes, and we're going to be unpacking all of these nutrients and high-quality nutrients. People are going to get a recommendation when they do the program of specific nutrients, what specific tests to do so that they can reduce the risk and get optimal. So, because, the quality of supplements is a very big issue today.
Yeah.
So
you want to make sure you're getting from reputable companies. We've talked about that a lot on the show, that some of the brands like Metagenics or things like that are physician grade, you want to spend the extra bucks and get that.
Yes, and personalization is definitely queen.
Yeah.
But definitely a good omega-3s from your diet. This is where flaxseed comes into.
So sprinkling some flaxseed on our yogurt in the morning or on our salad. Doing that every day can make a big difference.
It can. And as we spoke about at a previous issue, another issue we had was about phytoestrogens.
Yeah.
And so if you're going to take the free quiz, you're going to actually do better on it if you're listening today, because some of the answers are found in our conversation. So about flax being a phytoestrogen, soy being very safe. So there are some foods, even things like broccoli and Brussels sprouts, that can help you detoxify toxic estrogens, help your body to process better, and actually have been shown to reduce the risk of cancer in general.
Okay, so a phytoestrogen is a good thing. What is it?
Phytoestrogen is a good thing. And I hear that there's a lot of misinformation out there. So this is the truth about phytoestrogens. Phytoestrogens are plants, so food, that contains compounds in it that mimic estrogen. So mimic the hormones in our body, the estrogens.
So we want that, especially if you're in that perimenopause, menopause phase. You want to give your body chances to make estrogen.
You do. And actually, soy, this is another quiz question you're going to get right, has been shown to reduce the risk of cancer.
And people are afraid of soy. They think soy is not good if you're a breast cancer risk or a breast cancer patient. You have said that that's not accurate.
That's old news. That was 1999.
Okay.
So we've had
it's changed.
Oh, absolutely. So,
but it has to be good quality soy, like organic or non-GMO.
Non-GMO would be the least allergenic, but definitely things like non-GMO soy, edamame beans, these help to balance the estrogen levels. And as the research is coming out too, we're seeing it's about a balance of estrogen to progesterone. It's not just about estrogen being necessarily thought of as toxic as it used to be, but you want to get the right kind of estrogen. So those phytoestrogens help to compete with the toxic estrogens that are found in environmental toxins as well, called endocrine disruptors.
Okay, so not to get confused, we all think estrogen is something we need, but then there's the kind that there's the quote unquote bad estrogen, okay? And so people are trying to worry about that or take things. So eating the cruciferous vegetables, those are kind of like little vacuum cleaners. We want to eat those a lot.
Yes, those are very helpful for your body to be able to process the hormones. So yeah, it can get a little confusing with estrogen because there's three types of major estrogen. There are phytoestrogens found in plants that are helpful, like flax and soy, and then there are xenoestrogens, like the ones that are found in our environment that are toxic and are cancer causing, like the plastics and the PFAS and the flame retardants and things found in our food.
And we don't even think of those as estrogens. We just call them forever chemicals or bad things. Yes. Okay. But so those things, we want to eliminate our environment as much as possible. Now, a lot of women are hearing a lot. They're seeing it in their feed and are doing, some people have started it already with hormone replacement therapy. The studies have flipped on that as well, saying that women can do it. They used to think they couldn't do it if they had a breast cancer risk. Now women are finding out that they can do it, and some are saying it's making all the difference. What do you want us to know about that?
Oh, so much. I think we would need a lot more time. But basically, one of the things that you can see even in the article I wrote, if you go on artemiswellnesscenter.com under like extra learn, there's an article I wrote on phytoestrogens in women's health. So one thing I think women really need to understand is our food is medicine. And so
we can start with increasing with food.
Absolutely. Our food works like some of the hormone replacement. And the thing, if anyone is on hormone replacement, this is very important. You need to get your metabolites tested. So that's that test I told you about, the hormone zoomer, which we have available on our website. So under functional labs, and because your risk of cancer and hormone imbalances can occur even with estrogen. It's safer to do now, but there's still people having increased risk from it. So where there's a risk, there needs to be some options in understanding your risk. And this is where naturopathic medicine comes in. So if you don't know how you're metabolizing those hormones, you could be doing your body and your future a very big disservice.
Okay, so there's a test. And just in case they're not going to go and find you, if someone's listening, what test do they need to ask their functional doctor for?
Well, they could just literally go on our website, artemiswellnesscenter.com.
Yeah.
And you go into, I think it's under services, functional labs.
Yeah.
And under there, there's a test called Hormone Zoomer. If you have any questions.
Hormone Zoomer, like Zoomer.
Exactly. And if you have any questions, you can email us, info@Artemis Wellness Center, and we'll send you the link.
Okay. So these are, again, a lot of us have access now where you can order tests even without getting in. I know sometimes it's hard for people to get in. And want to let everyone know that Dr. Artemis Morris does see people remotely too, all over the world. So I know sometimes it's hard to find a good naturopathic doctor, which would be used in conjunction with your MD sometimes in Connecticut, because we have a situation where if you ever do need a medicine, you need that MD in Connecticut.
Yeah, so we work collaboratively, and we work collaboratively, you know what I'm saying, with oncologists as well. So I have a good relationship with Yale Oncology.
Yeah.
And so if there's someone who's going through cancer and wants to, minimize side effects, also prevent recurrence. So anywhere along the lines of a women's
you can be
journey,
a big partner. Yeah.
Yeah, and this program would work well anywhere along those lines because it's all about how to eat well, how to prevent disease, but we also do complementary care along with oncologists.
Something that else you can do that doesn't cost a lot of money and that you're seeing, and you do a lot of studies with Yale, is Mediterranean diet. Having a good quality extra virgin olive oil on your food every day can make a big difference.
Yes, olive oil is definitely, an elixir of life. And I'm speaking at a conference the end of this month in Pennsylvania about it. But this is, if you want to become an olive oil tester, I can let you know about that. But olive oil, 2 tablespoons a day lowers your blood pressure. If we go to those higher doses, it's been shown to reduce your risk of heart disease. Also, studies looking at cancer. So even like topically, it's been shown to reduce skin cancer prognosis. Olive oil, there's many different options in terms of taking olive oil. You want to get a good quality, even for breast health, because it lowers inflammation.
Okay.
And as we talked about, that's the step before pathology happens, is inflammation.
Okay, so even just putting 2 tablespoons on your salad, or some people just take shots. You're Greek. They just take shots of olive oil.
Yes, my 104-year-old great aunt, that's what her recommendation was.
Shots of olive oil.
Shots of olive oil, but it's great drizzled on broccoli with a little lemon juice.
People put it in their coffee. I know Starbucks tried to sell it that way for a while. It didn't go over well in America, but in Greece and other places, I guess they put it in their coffee.
We do. You can put it everywhere, but my personal favorite is to eat it, to cook with it, and it's very stable even at high temperatures.
Yeah, a lot of people think, I can't cook high temperatures with olive oil. The chefs will say that it'll burn, it'll this. And you say you can. In fact, in Greece, they fry with it.
Oh, yes. They've been frying with it for centuries, but that's a myth. We're going to unpack that on the course as well. And there's actually an article on that as well about the myths of olive oil. You can absolutely fry with it, and it protects your food better than other oils. It protects the antioxidants, which is what we want to reduce our risk of disease.
Okay.
Yeah.
So let's also unpack thermography. That's something that you offer that I don't think most women know much about. We get mammograms, you might get referred for an ultrasound. Why would you use thermography?
Thermography, it's an early detection method, and it's something that complements mammography. And if you have dense breast, like half of women do, that can make it harder to detect pathology or cancer on a mammogram, so you'll get your ultrasound. And then you want to complement it with thermography, which is it's non-invasive. There's no squishing. It's read by a board-certified radiologist, and Rachel Mazzarelli at Whole Health Holistics, she comes to our office at Artemis Wellness Center to do them. And it really helps to pick up lymphatics, which is another thing we're going to get into. Lymphatics play a role in terms of cancer, in terms of prognosis. And so it'll detect more than just pathology in conjunction with the conventional methods.
Okay. We're going to take a moment and hear from one of our sponsors, and we'll be back with more of the new program, Your Breast Self, and things that you can do to really change your risk factors. Let's take a listen.
Struggling with gambling? Wheeler Health's Better Choice program offers personalized support and treatment to help you regain control. Visit wheelerhealth.org to learn more and take the first step towards recovery today.
All right, so let's just play with the quiz. I know we don't have it right here. I want to encourage everyone, you can go to artemiswellnesscenter.com and take the quiz. But what are some of the questions? Ask me some. Maybe I know, maybe I don't know.
Good. Okay. Well, we unpacked the first one, but I'll just ask it anyway.
Okay.
So, if you have breast pain and tenderness, especially before your period or at any time postmenopausally, does it mean that you have breast cancer or breast disease?
No, you just told me that usually the, cancer has no pain.
Thank you. Number one, you got one right. Perfect.
All right. So a lot of us do think it's normal around the time of our cycle to feel that way. And you're saying that it's common, I guess, but maybe we shouldn't think of it as normal because it's still an imbalance.
Exactly. There are a lot of things that we have taken for granted that, I still have that pain.
I have
My
cramps,
stomach
I
hurts,
get bloated.
Right, that headache. All these things are your body trying to tell you something. And this is where it might not be a pathology, it might not be cancer, it might not be diabetes, but it's your body saying something's off. Go see a naturopathic physician. There might be some nutrients that you need. There might be some dietary changes. There might be some toxins. These are all the factors we're going to unpack in the program.
Okay. So if you were to take one, let's do this. Ask me some more questions and then we'll go into it. Yeah,
Okay.
so that was one. That was an easy one because we already talked about it.
Good job. Awesome.
Let's see. You guys all play along at home.
Yes, excellent. So does soy increase your risk of breast cancer?
No, you said it doesn't. They used to think that, but the new research says no. And in fact, you actually encourage women, even if they have breast cancer in their own history or their family history, to eat it, to have tofu, to have soy milk. It just, you prefer non-GMO.
Non-GMO, and it's all individualized, but flax seeds is a great way of getting it in too.
And
because it has
edamame
the
beans.
Edamame beans.
What about soy milk? Should we be buying soy milk as women?
Soy milk is fine too. I mean, this is where everyone's different. The fermented soy will be more generally tolerated and beneficial to everyone because it's pre-digested. So you're going to have the good microbiome effects in it. Oh, I have a quiz question that was not on the quiz because I'll be presenting at an Integrative Women's Health Conference in May.
Okay.
Do our breasts have a microbiome?
I'm just going to say yes.
Absolutely.
Okay.
This is new research, which is fascinating because another factor that really affects our risk of disease, including breast cancer, including breast disease, is our microbiome. Our gut microbiome is a mediator of inflammation, of how we're using our nutrients. But we do have a microbiome everywhere.
Everywhere. Okay. So if you're in your, let's say, young 20s and 30s, what would you recommend people do to really reduce their risk?
Right. So to prevent, you really want to start with diet.
Okay.
So you want to avoid toxins in your food. You want to avoid toxic skincare products. You don't want to check your makeup because that's one way that a lot of the endocrine disrupting cancer causing toxins come in.
Such as
certain lotions or skincare or spray tans, or these are the things that have toxins in it.
My daughter loves to spray tan. That's a bad thing?
Not a good thing. Oh. No, just look at the ingredients, unpack it. There's Environmental Working Group has something called Skin Deep where they can unpack it. But if it's not something that was available to your great grandmother, it's most likely not going to be good for you.
Okay.
Right? Because you have to really, and those toxins, for something to be available to stick to your skin or get into your skin, that's a fat soluble product. And the toxins that are fat soluble are the worst because they get incorporated into our fat cells and they can be obesogens. We've talked about that already, in another episode.
So, I mean, and we, I know you're not about fear, but basically we want to, eat as many whole, unprocessed foods as possible. Like just get the broccoli rather than the broccoli fry or whatever, that sort of thing. Like try to get back to the more basic foods, which actually are less expensive and easier to eat anyway.
Yes.
So, okay, so we've got this program. If people want to sign up in our last couple minutes together, how do we do this?
Yeah, it's very simple. You just go to the website, artemiswellnesscenter.com, and my team has been great in helping to get things organized. Thank you to all of them. So you just go and you look for your breast self, and we put the bra in breast self because that's another thing we're going to unpack a little bit. And you can see the free quiz there. You can sign up for the program. It's a 21-day program, starts October 10th, but it'll be available all the time. You know, we're going to do our launch in October, but anytime someone wants to stand, you know, have the program, they can. And encourage all the women in your life to do it, because we need to change these 1 in 8 stats.
Yeah, and actually men also can have breast cancer. I know it's not as common, but we need to think about that.
Yes, 1% of men do get breast cancer.
And it's more serious usually if a man gets it. Is that correct?
It can be, absolutely. But this program can be for men too. All the same factors that affect our hormones, that affect our risk of cancer in general, are found in the program. So men are welcome.
Okay. Obviously, smoking is a no-no, but how bad is it? Even if people have transitioned, maybe they're not smoking as much, or they're vaping, which I know is still awful. I really want to encourage folks, because smoking is a huge risk factor, right?
Yeah, for cancer in general, anytime you have oxidation, anytime you're having any kind of toxins, that will increase it. So if you're going to do anything toxic, you want to make sure you're detoxing too. So vaping actually contains fat-soluble toxins that can also be even worse than just like the plant, the nicotine plant. So there are ways of minimizing that. And so let's use our food as medicine. Get enough sleep is really important. There are studies showing that people who work the night shift can have an increased risk because of the way estrogen functions when we sleep.
Okay. All right. So go to ArtemisWellnessCenter.com, and this is your favorite. Is this one of your favorite olive oils, or where do people decide what kind of olive oil they want to get?
Well, I have a favorites list, and we always give those out when we do a program. We got discount codes. But Seasons is great. They're in Bethlehem, Pennsylvania, and that's where the conference is going to be the end of the month. As well. And they've got salt, they've got other delicious products. So I would start there.
Yeah. And as far as vitamin, this is a vitamin D3, 5,000 units plus K. Metagenics is a great brand. You can Google that, and I know you have lists on your website as well. But Metagenics is available to, they sell usually through physicians, but you don't have to be a physician to buy it. But you are really a big fan of making sure you're getting pure supplements, because you don't want to take something that you think is making you healthier and then have it have things in it that are only making you less healthy.
Yes, you are doing your body a very big disservice if you're just Googling something and taking it, because, you know, even if you have a good quality, you don't know if that's right for you. You don't know if it interacted with your medication. So I really encourage someone, if you want to save money, time, and have your supplements really work for you, see a naturopath. And we do have on our website, you can go and see what supplement companies we use. You could sign up, see some of my favorites. And we have discount codes that we send to our patients.
Okay. How much of breast cancer in our final time together is genetics?
So great question. Only 5 to 10% at most. And that's a big myth as well. So 95% of breast cancer is non-genetic. And this is, you know, can be a way of really understanding how important diet and lifestyle is. And that's what we're going to unpack.
Thank you, Dr. Artemis Morris. Thanks for everyone for being here on the CURES show. You can listen on the podcast, share it with someone you love. Have a great day, everyone, and be well.
CURES is sponsored by Wheeler Health's Better Choice program. More at wheelerhealth.org.